Well, families come in all different forms. And with it being Pride Month, we want to highlight that it's possible and the best ways to go about it for LGBTQ individuals and couples to have children of their own. Joining me now are Patrick Dunn, the executive director of the New Haven Pride Center, and Kathy Paniotti. She's an RN and a third-party reproductive manager at the Center for Advanced Reproductive Services at UConn. Thank you both for being with us.
Thank you for having us.
You know, Kathy, I want to start with you. I've had a chance to go out to the center before. We've even done stories on this very topic of just how inclusive family planning can be now, and all the different advancements in technology and science is really allowing anyone to create a family. Can you talk a little bit about that?
Yes, of course. Thank you. The center has been a longtime supporter of the LGBTQ community. In fact, we've helped create 1,600 families within this community, with 1,600 babies born. But yes, as time goes on and technology improves, we do offer more options for gay men, lesbian women, and for our transgender population as well.
So we'll talk about some of those options coming up, but Patrick, I want to bring you in and talk about what is the importance of even just having this inclusive type of medical care and getting the word out to families in your community about what's available right here in Connecticut.
Yeah, you know, it's so funny, and thank you again for having me today. It's really important that the medical organizations and the healthcare providers who are willing and able and learned about our community and willing and able to serve our community be highlighted to our community, right? Because there's unfortunately so many bad medical experiences that members of our community have, and having organizations like the Center for Advanced Reproductive Services, among many other great medical providers in our state, is super key and really vital, and just kind of furthers the idea that I always say that Connecticut is one of the best places to be LGBTQ+. And you know, specifically when you're talking about family building, having, you know, family building is an extremely intimate process. There's all kinds of conversations that you have to have as a future parent, right? It doesn't matter if you're LGBTQ or not. And so having a provider that you can trust, and a provider that will kind of meet you in the middle of your own journey is super important to make sure you have a really good process and a good experience. And that's one of the reasons we're doing this program on family building, is to really highlight kind of the knowledge that people should have going into the process.
Well, and Kathy, let me bring you in, because these are questions that people sometimes don't ask, and there's so much available. Let's start with gay men. How are you helping them build biological families?
Yes, for gay men, they need a third party. What is a third party? It's a third person to help make a baby. Gay men have the option of using an egg donor, either somebody that they know, or we have routes for them to find a non-directed egg donor, and they would need a separate female to carry the pregnancy, would be their gestational carrier.
And you help with that entire process, right? Even finding the gestational character and in counseling, donor rather, and even counseling them of what's necessary and what type of situation you want to look for depending on your family situation.
Yes, for sure. It's really a multidisciplinary practice. We do help them medically prepare for their cycle, psychologically to prepare for the cycle, prepare for the relationships with the women, and prepare for parenting. We do guide them as to resources where they can find their egg donors. We do screen egg donors here, and we have a supply of egg donors for them to choose from. But we work closely with several gestational carrier agencies in the tri-state area to help them find the best match for them.
I do want to let people know who are watching on Facebook right now that I'm monitoring the feed. So if you have a question that you want, please ask it. I'll try and get it to our wonderful experts here. Also, they might want to look later on and see some of the questions that are out there. Patrick, do you have a sense of just if it's changing, if more people in the LGBTQ+ community are wanting to have children, and specifically biological children?
Well, I'll say if my partner is any indication of the rising desire, then yes. I think he's bringing it up on a daily basis now. But yes, so Connecticut is actually the #1 state for LGBTQ parenting in the country. It's a statistic that was released from the University of LA. They do like kind of some of the bigger studies about the community kind of nationally. And so they had said that we had the highest percentage of parenting in the community in the country. And I think that speaks to us having a state that values the community, having resources like the Center for Advanced Reproductive Services that are willing to work with us to create our families. And also, you know, I mean, I have to give a shout out to the legislature of the session that ends tomorrow or whatever day this week, that passed this Connecticut Parentage Act and and signed it into law on June 1st, which is the most comprehensive parentage law in the country, and not just for LGBTQ people, but for all families. And it really, the legislature worked so hard over the course of over 3 years to create this bill that will protect all families and all children in our state. And just it goes to show why that there are more parents here is because our state and our community is making the effort to really make sure that kids, regardless of who their parents are and who their parents love, are supported and connected to the resources they need.
Yeah, and people may not realize, I know they're hearing about the Parentage Act. If you could give us a short summary of kind of some of the rights that were in question, that the reason you needed this act to pass and what it's going to do for families.
Sure. There's, you know, it's a really broad act. It was really this incredible process where there was folks from the Yale Law School working on it, the students that, you know, I think the lead professor who is kind of leading the effort said like 40 different law students worked on it. There was legislature from all over the state working on it. It passed with only one no vote. And everybody else voted yes. It had super support. But basically, it was tackling a lot of basic things that there was like these old weird laws on the books that created weird loopholes for heterosexual couples and LGBTQ couples. There was some things that it closed around single parent households and addressed some issues with kind of birth certificates, which was a big loophole for LGBTQ people. It also made all the language gender neutral, which means that you're talking about parents, you're not talking about the woman or the man, which you know, has a whole slew of benefits, obviously, for LGBTQ people, but it's just as important to protect heterosexual, cisgendered, you know, parents as well, right? Because just because they're a dad versus a mom doesn't mean that they shouldn't have the same right as a parent. And so I think the folks that worked on it did a really amazing job at looking at every law on the books and trying to pass something that was super comprehensive.
And Denise is asking, what is the name of the bill? I believe it's the Parentage Act. Is that correct?
Yes, the Connecticut Parentage Act.
Thank you so much. Thank you. I want to bring you back and we talk about as we talk about the center, Kathy, that this is something you've been working on for a while, of just even having the experience that the forms you fill out won't all say mother and father, and even helping people who are of the same sex get insurance coverage, which has been a little tricky, I know, for some of the families I've interviewed out there, that you had to work around some older language, older loopholes. But you want people to know that they can not only do this, but they can be covered by health insurance and other things that heterosexual couples have.
Correct. We've come a long way. I will say I think there's still a long way to go in terms of insurance companies. But yes, what we're finding is that insurance companies may not scream it out to you. They may not direct you to the paragraph in your policy that says same-sex reproductive practices are covered, but more and more employers are covering. So we definitely encourage you to really study your insurance policy. Again, they're not gonna draw you to it because that would cost them money, right? But we want you to know that most employers are taking a look at this, some of them for the first time, but there may be coverage for at least parts of this cycle when in the past there was no coverage. So things are improving for sure. Our paperwork is changing. We have learned a lot, and I want to say that we're always learning, and our best teachers are you. And we want you to tell us when we're doing great. We want you to tell us where we're falling short so we can always be improving the processes that we already have in place.
And we talked about gay men, but let's say it's a lesbian couple. What types of services are available?
They have a few more options because we have more reproductive pieces available to us. So one woman within the couple may decide to get pregnant and provide both the egg and carry the pregnancy. But we also do a cycle called shared conception or reciprocal IVF, which means one of the women in a lesbian couple provides the eggs through an oocyte retrieval, and the other woman carries the pregnancy. So they both have a biological part of this process, which is just amazing.
Yeah, so there's so many options, and I guess the encouraging thing is that you want people to reach out. You can call the center at UConn. And also, what about just services, Patrick? What do you want people to know that's available to them so that people can feel like they have resources to answer their questions?
Yeah, so we here at the center, a lot of the questions that come up around family building, we do refer out through our case management program, just because there are amazing experts, people like Kathy, that just can answer questions so much better than we can about this process and what it takes. But that said, we do a lot of programs for youth and family here at the center. We try to make sure that we create environments where families can come. We do programs like the one we're doing next week about family building, where we bring those experts into our walls, so to speak, to talk to the community. So on next Thursday, we're doing this program on LGBTQ parenting in partnership with the Center for Advanced Reproductive Services, and that's at 6 o'clock, and it will be streamed live. So if you are watching streaming live, you already know how to get to access to it, but it will be streamed live and give folks the ability to kind of have some of their maybe basic questions answered, think through some of the processes. And we like to do things like that to like share the resource.
Shout out the website that people should go to if they want to be a part of that.
So you can go to newhavenpridecenter.org to watch it, or you can go to the New Haven Pride Center's YouTube channel or our Facebook account, which is all just New Haven Pride Center.
Okay. And Kathy, I know you have a Facebook group specifically that I've done stories on that for non-traditional families that are coming together and where they can get their answers at UConn as well.
We do for sure. We would advise people to just look at our website, the Center for Advanced Reproductive Services. We'll be streaming the panel discussion live there as well. And within our website, they can link to Facebook groups, which are mainly started for and run by patients. And there is a group for the LGBTQ community. And we encourage you to check it out, connect with patients who have been through the process. And please just call us. No question is silly. There's so many questions, but we have so many answers. So just call.
Okay, yeah. And I want to let everyone know just again, if you're wondering when that event is, it's Thursday, June 17th, 6 to 7:30. It's educational. People can ask those questions. They can watch the live stream. They can reach out. And that's in partnership with the New Haven Pride Center and with UConn. And so, Patrick, I know your phone number is, well, I don't want that. I'm not going to shout out that cell phone number because I think that's your personal. I'm not going to.
Yeah, don't sound out my cell. No, it's
you did say the website.
Enough people call random people call my cell phone as it is. No, it's 203-387-2252 is just our main line here at the center. We are now open. We're proud to be open again now post-COVID, although we do ask you to wear a mask if you stop by, and we do have case management services that will allow you to connect with resources like the Center for Advanced Reproductive Services if you are looking to start a family and want to talk to someone that has all those expertise.
And Kathy, I know folks can go to, it's a real easy website to remember, uconnfertility.com. They can get a lot of information that way as well. So thank you to both of you, both Patrick and Kathy. Thank you for being here, for sharing some important information and celebrating Pride Month as a way to be inclusive here in Connecticut.
Yes, thank you for having us.
Thank you, Kara.
Have a great day, everyone.
You
Bye.
too.